Good afternoon, everybody. My name is Ricardo Romero Morales. I'm a lead public information officer with the County of Santa Clara. Thank you, everybody, for being here. Today, we're going to be providing an update regarding booster shots for our community. Today, we have the honor to have Dr. Sarah Cody, Health Officer and Director of Public Health in Santa Clara County, and also Dr. Marty Fensterscheib, COVID-19 Vaccine Officer. We will start this press conference in English. We will then move into questions and answers, and we will end with a statement in Spanish, Chinese, and Tagalog from the podium. Without any further ado, I welcome Dr. Sarah Cody. Thank you.
Hi, everybody, and happy almost Thanksgiving. Dr. Fensterscheib and I just wanted to briefly come out and talk with you about booster shots again. And our top line message is we really encourage everyone to get out and get their booster shot. And pretty much everybody in our population is eligible. Those are the top line messages. So we're coming into the holidays, we're coming into one of the busiest travel days a year, and there's a great way to protect yourself and your family and your friends in the community, and that is by getting a booster shot. We know that protection fades from the original vaccine series, and so it is important to get a booster. So if you're 2 months out from J&J or 6 months out from Pfizer or Moderna, it's time to get a booster, and boosters are widely available. In our county, we know we can look at our website and see that a little over 200,000 people have gotten their booster, but we know that a little over 1 million are eligible to get a booster based on the time since they got their original series. So what that means is only 20% of people who would really benefit from a booster have gotten it. And now's the time. It can really increase everyone's safety for Thanksgiving. And we all want to enjoy a safer Thanksgiving, particularly after last year where we didn't have a vaccine available and it was so much more difficult to have a safer gathering. With that, I'm happy to answer questions after we wrap up, and Dr. Fensterscheib has a few comments as well.
Thank you, Dr. Cody, and again, happy holidays to people out there. Again, as Dr. Cody mentioned, about 20% of people that are eligible have been vaccinated with the booster. And I think it's also important to note that those that are 65 and older, who are even higher risk, only 39% of that group of individuals in our county are eligible that have been vaccinated. 39% of the 65 and olders have been vaccinated with a booster. So again, we urge people, again, out there that have underlying medical conditions and who are over 65. But as Dr. Cody mentioned, everybody pretty much is eligible for a booster, and that will make your holidays much, much safer because we know that the levels of antibodies have begun to drop over time. We noted that after 6 months or so. So for full protection, you really need to get your booster. And then really realizing that I think today's Wednesday, so in 2 weeks, that'll be the busiest travel day of the year. And so if you get your booster right away, you will have it in effect, because it takes 1 to 2 weeks for the booster shot to actually be in effect. So don't wait to the last minute to get your booster. There are plenty of slots available in over nearly 200 providers in this county. And the county's website, SCC FreeVax, has links to all of the providers that you may wish to go to, including the retail pharmacies, all of the clinics that the county serves, as well as Kaiser and the other hospital clinics and the community clinics. So again, we urge you to have a safe and happy holiday, protect your family, and get your booster. Thank you.
All right. Questions? Mercury News.
So you said that almost everybody is eligible, but the CDC and FDA said they want to limit the shots to 65 plus, high exposure at work, high exposure at home. They weren't saying give it to everybody 18 and older. That's what they want to be done.
If you look at the CDC guidelines and you drill down to the various groups, what you end up with is the recognition that pretty much everybody is eligible. And the fact that we know that the protection from the vaccine does wane or fade over time, the fact that we are going into winter holidays, a time of gathering, that's why we really want to emphasize and underscore that pretty much if you drill down, everybody falls into an eligibility group, and there's a lot of benefit from getting a booster for yourself and for others. I'm happy to just sort of give you a flavor and walk you through this discussion about eligibility groups. Remember that there were two main groups: those for whom the vaccine was really urged, the 65 and ups, live in a long-term care facility, et cetera, et cetera, et cetera. But I think what the public heard was, I have to be 65, otherwise I shouldn't get a booster. And that's not correct. That's not correct. So the other groups where it's may wish to or recommend, pretty much all of us fall into that because that's you're 18 or over, and you may have increased risk of exposure due to your interactions with the public. You may have an underlying medical condition. Underlying medical conditions include everything, including depression, anxiety, hypertension, diabetes, obesity. There are very few of us who don't fall into meet one of those eligibility criteria. And then when you think about if you have increased risk of exposure because you interact frequently with the public, or perhaps you live with someone who interacts frequently with the public, or you live with someone who's at increased risk of something bad happening, pretty soon you wind up with just about everybody who would be eligible. That's why we want to simplify the message and simply say, the holidays are coming, our case rates are flat to increasing, people are going to be gathering, and there's a tool available, widely available, that we can all use to increase our safety and protection, and that's a booster shot. So we really encourage just about everybody, because just about everybody is eligible to get a booster shot.
All right. Dr. Cody, is there any concern that there may be some vaccine fatigue at work here? Enthusiasm, how does it compare to the first time around?
Regarding booster shots, we know that of the 1 million that are eligible, only 200,000 plus have gotten their boosters so far. And this is eligible because of the time that's elapsed since they finished their series. There may be many reasons for that, but one of them may be a misunderstanding about whether people can get a booster. And so what we want to say is, yes, you can. They're available, and they're going to be extraordinarily helpful, so please get your booster.
Dr. Cody, do you think we kind of botched the messaging right up front? I mean, do you think that we're sort of in a situation of our own making? Because, as you said, people kind of did hear, I got to be 65, or maybe I've got to be a cancer survivor, but everyone else is maybe not eligible. Did we kind of make a mistake in the messaging at the outset about boosters?
The boosters have rolled out first Pfizer, then Moderna, then mix and match. So I think there's been quite a bit of complexity. And that's why we want to boil it down now and make it quite simple and let the public know that pretty much everybody is eligible for a booster, and there's lots of benefit from a booster. So before the holidays, please go ahead and get a booster shot.
Quick follow-up, if I could, just for Thanksgiving, if people have gotten their first 2 shots but not a booster, they're meeting together as a family for a meal, maybe without masks, should they be concerned? Should they consider themselves, in essence, unprotected or less protected than if they were to have gotten that 3rd shot?
What we know about the vaccine is that the protection can wane. So even in a group of people who are all vaccinated, there still's a chance that COVID could spread at a gathering. What 2 years into the pandemic, we want people to know all the tools they have and to use them. So let's review. Vaccination, really important. Make sure that everyone at the gathering is vaccinated. If you can encourage everyone at the gathering to get their booster, even better. We really recommend that. And fewer people is better. Increased ventilation is better. Outdoors is better than indoors. But you might not have to put every single layer of protection and prevention in place, particularly, for example, if the gathering's not that large and everyone's boosted, you can feel pretty safe indoors without a mask off, right? So pick a couple layers and really double down on them.
Just anecdotally, a lot of people who have received the booster said that they got a fever, they got really sick, and of course they told their friends. Are you seeing, or are there any reports of adverse reactions or people getting more sick from the booster? And also, at the pharmacies, you have to fill out a form saying you meet these criteria. The pharmacies sound like they're not going to be as lenient as the county. So can you talk a little bit about that as well?
Yeah, I'm gonna let Marty cover this one.
Okay.
So the vaccines are the same that we're using for the booster. So if you've had 2 shots or one of Johnson & Johnson, you're getting the same, or you can mix and match. Side effects are common. I had my booster, and I was out for about 24 hours. So we expect people to have similar side effects, or perhaps even more significant side effects than they had the first time around. And again, most common, just that soreness all of us have had, but it's not uncommon also to have a low-grade fever, maybe some chills, fatigue, you just don't want to get out of bed that day, but all of it goes away. And so it's much more important for people to just put up with that one day of side effects because they have the benefit of the protection for a long time to come. The pharmacies are still utilizing in their sign-ups for appointments some standard language that comes from the CDC. They're getting their marching orders from the CDC. I've noticed in looking today at one of the pharmacies that they've made it a little bit more broad and basically list everything and basically say, do you meet those qualifications? Do you need a booster? And pretty much what they're saying is, do you feel you need a booster? And then they're providing the booster. Nobody will be turned away who wants a booster. In fact, the state came out with some language in a letter yesterday, I believe, that basically said, yes, we're looking at those CDC guidelines. Those are still in place, but nobody will be turned away who wants a booster.
All right, yeah. There are reports about a rise in cases and hospitalizations across California. What is the situation here in Santa Clara County, and are you guys worried because of the winter is coming?
The question is, what are we seeing in Santa Clara County as far as cases and hospitalizations? So what we saw was very low during the summer, an uptick with Delta. We had the surge with Delta. Then things began to come down, but they've not settled down to where they were before the wave. They've flattened, and in fact, they are slowly drifting up. So we, post-Delta wave, we got down to a 7-day average case rate of around 7 per 100,000. Now we're drifting up into the low 8s, but it's not zipping up, it's flat to drifting up. So makes us a little nervous. Hospitals so far in our county, it's pretty flat, which is good. We're keeping a close eye. In other regions of the state, case rates, hospitalizations, and positivity rates are on their way up again. So as always, it's something where we need to keep a very close eye and keep reminding our community what they can do to protect themselves and their families.
Any questions going down the line? NBC.
If you don't mind, if I just shift gears, because everyone's curious about the vaccination for kids ages 5 to 11. How is it going? What are the numbers looking like? And is it what you would like to see? Is it better? Is it about what you expected? Can you give us a sense of that?
Yeah, there's been quite a bit of enthusiasm. It's going quite well. I think Dr. Marty may have some numbers off the top of his head that I don't have off the top of my head. And so, do you have more
Yeah, a little bit.
in your head?
So remember, the vaccine was approved just on the 2nd. We started on the 3rd. And the county system itself, because I don't have the data for all of the providers, because that will be up on the state's website, and we're told that will be tomorrow, most likely. And so for the county itself, a limited number of providers, we've done over 13,000, nearly 14,000 doses to children 5 to 11. And we suspect that's on the low end for what we have seen in the county. All of the providers have vaccine. We have sufficient supplies right now, and we expect, again, to get additional supplies. So the kids are excited about it. We're already in schools, and the parents and the teachers and the students are all very anxious about and excited about getting vaccinated.
Last question, KPIS.
All right, this is a question for Dr. Cody. We'll jump up there. And since it's the last one, I'll go ahead and ask a two-parter. You mentioned kind of different things that people can do to layer on to be secure. I'm wondering if there's a value in getting the booster plus perhaps getting tested prior to a meeting like that. And then previously you've said that this had become an epidemic of the unvaccinated. Is that statement still largely true?
We know that there are many layers of prevention, and so vaccination, the most important layer for anyone who's eligible to get vaccinated to get your primary series. Boosters, very important sort of adjuvant to vaccination to ensure that your protection is high. So a gathering of everyone who's vaccinated and boosted should be quite a safe gathering. You mentioned testing, that's also quite important. So if someone's too young to be vaccinated or it's been a long time and they're not boosted, testing right before a gathering will also increase safety. Limiting the number of people at the gathering sort of falls into the social distancing, just probability, right? Fewer people gathering, less chance that one of them is going to be infected. And ventilation. And remember, simple things like opening doors and windows can improve ventilation and airflow and be quite protective. So that's what we want everyone to do. We're 2 years into the pandemic. I think we've moved past the point where we're being so prescriptive about it. I think we know that our public knows what keeps them safer, and we want to ensure that they have the tools. Vaccination, testing, masking, distancing, and ventilation. That's what you need to layer up.
And is it still an epidemic of the unvaccinated principle?
We are seeing higher rates among people who are not vaccinated, higher case rates, and hospitalization rates. This is sometimes difficult message to get across. In our county, the vast majority of our population is vaccinated. So if you just looked at cases, you would see, wow, a lot of cases are vaccinated. Why? Because the whole population is well vaccinated. But if you look at the rate among those who aren't vaccinated, what's the rate, and you compare that to our vaccinated, you'll see there's quite a difference. And it really does underscore how protective the vaccine is and how important it is to get vaccinated. Thanks.
All right, thank you so much. That concludes the English portion of the press conference, and we're going to now move to language access, so we'll start with Spanish. Muy buenas tardes, mi nombre es Ricardo Romero Morales, soy oficial principal de información pública para el Condado de Santa Clara. Esta tarde, los oficiales de salud del Condado de Santa Clara, del Departamento de Salud Pública, les están urgiendo a hacer un llamado a todas aquellas personas quienes ya son elegibles para recibir la vacuna de refuerzo, a que se la pongan lo más antes posible. Sabemos que los días festivos están a la vuelta de la esquina. Sabemos que el Día de Acción de Gracias, al igual que las vacaciones de invierno, se aproximan y queremos asegurarnos que nuestra comunidad esté protegida lo más posible. También sabemos que hace un año nosotros también vimos la tercera ola de casos de COVID-19 alrededor de estas fechas. Para poder prevenir es importante seguir usando nuestra mascarilla y también estar vacunados. Hemos estado observando que con el paso del tiempo la eficacia de la vacuna empieza a disminuir. Y esto es aproximadamente 6 meses después para aquellas personas quienes recibieron la vacuna de Pfizer o Moderna, y aproximadamente 2 meses después para aquellas personas que recibieron la vacuna de Johnson & Johnson. Es por ello que les estamos urgiendo a la comunidad que por favor hagan sus citas para ponerse la vacuna de refuerzo si aún no se la han puesto. Pueden visitar nuestro sitio web, el cual es sccvacuna.org, o llamar al 211. Hasta el día de hoy tenemos más de cientos de citas disponibles en nuestro sitio web para que usted pueda hacer una cita el día de hoy, o también puede llamar vía telefónica. Hasta el día de ayer, aproximadamente solo 200,000 personas de nuestra comunidad del condado de Santa Clara se han vacunado o se han puesto la vacuna de refuerzo. Y esto es sobre aproximadamente 1 millón de personas a quienes ya son elegibles. Esto se traduce a que aproximadamente solamente el 20% de aquellos quienes ya son elegibles se han puesto la vacuna de refuerzo. Y en cuanto estamos viendo a personas mayores de 65 años, aproximadamente solo el 39% se ha puesto la vacuna de refuerzo. Es muy importante que con todo esto de los días feriados que se aproximan, sigamos usando y siguiendo los métodos de prevención posibles, los cuales incluyen la vacunación, el uso de mascarilla. Si se van a reunir con personas con las quienes no viven, que lo hagan en grupos pequeños, al igual a que maximicen la ventilización que tienen en sus hogares a través de abriendo puertas y ventanas. Una vez más, toda esta información se encuentra en nuestro sitio web, el cual es sccvacuna.org. Gracias. We will now go ahead and move into the Vietnamese portion of the press conference.
Kính thưa quý vị, với mùa lễ đang đến và thuốc ngừa đang giảm dần hiệu lực với thời gian, tất cả những ai hội đủ điều kiện đang sinh sống hoặc làm việc trong hạt Santa Clara đều được khuyến khích nên đi tiêm ngừa ngay. Liều hỗ trợ thích hợp với hầu hết tất cả mọi người từ 18 tuổi trở lên và đã tiêm liều thứ 2 của Pfizer hoặc của Moderna 6 tháng trước đây, hoặc là thuốc ngừa của Johnson & Johnson 2 tháng trước đây. Tính cho đến ngày 9 tháng 11 thì chúng ta mới chỉ có 206.765 cư dân trong hạt Santa Clara đã được tiêm liều hỗ trợ. Và với lễ tạ ơn gần kề thì việc bảo vệ gia đình, trường học và sở làm ngày càng trở nên quan trọng hơn, vì sẽ có nhiều người sẽ đi chơi xa hoặc là sẽ họp mặt để mừng lễ, tạ ơn và các lễ vào dịp cuối năm. Tuy hiện nay số trường hợp nhiễm trong quận hạt không tăng cao, nhưng đã có bằng chứng cho thấy là thuốc tiêm ngừa sẽ giảm dần hiệu lực theo thời gian, và tỷ lệ nhiễm trong những nơi khác trong tiểu bang cũng đang tăng dần. Và chúng tôi muốn bảo vệ mọi người được an toàn và đồng thời cũng ngừa đợt bùng phát có thể sắp tới trong mùa lễ. Chúng tôi kêu gọi mọi người hãy ghi danh đi tiêm liều hỗ trợ để bảo vệ cho chính bản thân, cho gia đình và cho bạn bè. Hãy đi tiêm liều hỗ trợ ngay để họp mặt mừng lễ tạ ơn được an toàn hơn. Đây là cách bảo vệ cho người thân thật dễ dàng. Tiểu bang California gần đây đã thông báo cho tất cả các cơ sở y tế cho phép bệnh nhân tự xác định rủi ro lây nhiễm của họ và không được từ chối những bệnh nhân muốn đến và muốn tiêm ngừa. Quý vị có thể lấy hẹn tiêm ngừa cái liều hỗ trợ tại các địa điểm của quận hạt tại sccfreevax.org, và có nhiều địa điểm sẵn sàng cho quý vị tiêm ngừa mà không cần có hẹn trước. Thuốc ngừa của Pfizer, của Moderna và của Johnson & Johnson có đầy đủ trong khắp quận hạt. Ngoài ra cũng có nhiều bác sĩ và hiệu thuốc cũng cho tiêm liều hỗ trợ. Tiêm ngừa trong quận hạt hoàn toàn miễn phí cho cư dân trong mọi tình trạng di trú và không cần phải có bảo hiểm y tế. Xin cảm ơn quý vị. Chúng tôi là Như Hạnh, nhân viên truyền thông của hạt Santa Clara. Và tiếp theo đây chúng tôi xin mời người phát ngôn nhân dành cho tiếng Hoa.
大家好，我是圣塔克拉拉县紧急行动中心的 Anchen。圣塔克拉拉县卫生局建议所有符合条件在圣塔克拉拉县居住或是工作的人士去接种新冠疫苗加强剂。只要年满18岁，6个月前接种过第二剂辉瑞或莫德纳疫苗，或是2个月前接种过1剂强生疫苗的民众，现在几乎都可以接种。截至11月9日为止，全县仅有20万左右的民众接种了加强剂。初期疫苗所提供的保护力会随时间而减弱。虽然圣塔克拉拉县的确诊率目前持续保持平稳，但是在全国其他地区的确诊率正在逐渐的增加。感恩节将至，民众开始计划出行和家人朋友团聚之际，如何保护自己、家庭、学校及工作场所的健康与安全就显得格外的重要。我们希望保护公众，避免新冠疫情再次的上升，并且呼吁民众在假期前接种加强剂，让感恩节假期能够更安全。许多诊所和药局也提供新冠疫苗加强剂的施打，我们有足够的加强剂让民众来接种，可以上网 scc.freevax.org 预约。祝大家平安健康。Next, Sherry Ann will be providing the statement in Tagalog. Thank you.
Magandang hapon po. Ako po si Sherry Ann Mangligot, ang inyong Public Information Officer dito sa Santa Clara County. Sa paglapit ng mga holiday at pagbaba ng proteksyon ng bakuna sa paglipas ng panahon, ang mga residente ay hinihikayat na kumuha ng booster shot ngayon. Ang Departamento ng Pampublikong Pangkalusugan ng County ng Santa Clara ay nagre-rekomenda na ang lahat na kwalipikadong miyembro ng publiko na nakatira o nagtatrabaho sa Santa Clara County ay tumanggap ng booster shot sa COVID-19. Ang booster ay naaangkop para sa halos lahat ng taong nasa edad na 18 at pataas, 6 na buwan pagkatapos ng huling Pfizer o Moderna na pagbabakuna, o 2 buwan pagkatapos ng Johnson & Johnson na pagbabakuna. Ang pagprotekta ng mga pamilya, paaralan, lugar ng trabaho at ng ating sarili ay naging mas lalong mahalaga sa paglapit ng Thanksgiving holiday na 2 linggo na lang ang layo at sa dami ng mga taong bumibiyahe at nagtitipon kasamang pamilya at mga kaibigan. Habang ang bilang ng kaso sa komunidad sa county ay kasalukuyang hindi tumataas, ang mga bilang sa ibang lugar ng estado ay patuloy na tumataas at ang inisyal na proteksyon ng bakuna ay nakumpirmang bumababa sa paglipas ng panahon. Ang mga klinika ng county ay tumatanggap ng mga appointments sa www.sccfreevax.org at nakahanda ang maraming lokasyon na tumanggap ng mga walk-in na pasyente para sa mga booster shot. Lahat ng Pfizer, Moderna at Johnson & Johnson na mga bakuna ay available sa loob ng county. Bukod pa rito, marami sa mga opisina ng doktor at parmasya ay nagbibigay ng mga booster shots sa COVID-19. Ang mga pagbabakuna sa buong county ay walang bayad sa publiko, ang insurance ay hindi kinakailangan at walang kinakailangan sa imigrasyon. Maraming salamat po.